Hello, and welcome to the ASQ3 and ASQSE2 overview. This virtual webinar will cover the basic concepts of administering, scoring, and interpreting the Ages and Stages 3 and Ages and Stages SE2 developmental screening tools. Contents of this webinar is designed to provide an overview of the administration, scoring, and interpretation of scores for both screening tools. It is not intended to replace any formal foundational training on how to conduct Ages and Stages questionnaires. For additional information on formal foundational training, please visit the PAKEYS website. Okay, let's get ready. Before starting, prepare yourself with the following tools: a clean working space, pencil, a blank paper, one blank ASQ3 and ASQSE2 developmental screening tool. Download the ASQ3 and ASQSE2 learning template. Note, return this template to sstarling@bsaece.com upon completion. Make sure you have technology and a working device with working internet and 1 hour of uninterrupted time. Here are some guides for organization. Plan ahead at least 1 hour of time for completion of this webinar. Close out extra tabs of the web browser to improve internet connectivity. Turn off or mute extra devices to minimize distractions. And then have ready the ASQ3, ASQSE2 learning template for taking notes. The purpose or goal of this training is to provide developmental or basic concepts for administering, scoring, and interpreting scores of the ASQ3 and ASQSE2 developmental screenings. Here's a few objectives. One, we want to make sure we review the basic concepts of administering these screening tools, identify some key tips for administering and scoring and interpreting, and making sure there's a connection between the administration of the screening tools and the internal ASQ3 and ASQSE2 policies and procedures. Here are some instructions on downloading the learning template. Click on the link, print out the template, and utilize during this webinar. Again, once complete, submit to sstarling@bsaece.com. Okay, take a moment and complete your pre-test on your learning template. We'll pause. Here are 2 additional links to help you gather a better understanding on how to score both screenings. Click on the links before proceeding to the next slides. There are 2 links available for you, the ASQ3, and then there's a link for the ASQSE2. Once you've reviewed the links, it's time to review the remaining slides. Here are some key points for practice. First, what is it? What is the ASQ3 and the ASQSE2 developmental screening tools? These Ages and Stages tools are designed for early childhood professionals to identify young children in need of further evaluation and assessment. So why do we use it? These developmental and social emotional screenings are important tools to help support children's healthy development. They also allow parents and guardians and professionals to see where children are developing and then identify those areas that may need more support. Here's the first key point for best practices. When should I administer these tools? Key point number 3 for administering. What should I do before starting the screenings? Before starting, explain to families by way of the family letter that the first 5 years of their child's development is extremely important. Also explain how the ages and stages developmental tools are used to help monitor and support their child's healthy growth and development. Help families to understand how their participation in the screening process is valuable and is designed to partner in celebrating the child's developmental milestones. Working together, you can both identify areas where the child may need additional support. Key point number 4, administering. What is the process for starting the ASQ3, ASQSE2 screening assessments? Always use blue or black ink only when completing. Select the appropriate screening tool according to the child's chronological age or adjusted age. For example, if the child was born more than 3 weeks premature, adjust the child's age by weeks of prematurity and then select the appropriate screening tool. This would apply for children up to 2 years of age. You can also use the calculator for help by visiting the agesandstages.com website. Always fill in demographics, and important points to remember should be considered. Key point number 5, scoring. How should I administer the ASQ3, ASQSE2 screening assessment? Here's how you do it. So, practice activities with the child before marking a response. These activities can be found in each screening tool packet. Read each question carefully and then fill in the best answer. For the ASQ3 screen, fill in each circle to indicate either yes, sometimes, or not yet. If you've answered yes for the ASQ3 screening, you've seen that child perform that skill all of the time. If you've answered sometimes on the ASQ3 screening, you've seen that child perform that skill some of the time. If you've indicated not yet on the ASQ3 screening, that child has not yet performed that skill. On the ASQ3 screening, yes equals 10 points, sometimes equals 5 points, not yet equals 0. For the ASQSE2 screening, fill in the appropriate box about the child's behavior. You would indicate often or always, sometimes, or barely, rarely, never. You will also indicate in the last box by checking if that behavior is of particular concern. For the ASQSE2 screening, often or always indicates a point of Z or 0. Sometimes indicates a point of V or 5 points. Rarely or never indicates a point of X or 10 points. Again, if that particular behavior is of concern, fill in a circle at the end, and that scoring will indicate a point of 5. Always complete the section for overall scoring by providing a descriptive response.